So one of the most common complaints that people have throughout their life is something that we affectionately call dry eye disease. And dry eye takes on many, many different forms. So let's talk about what causes dry eye. This is a schematic of the normal eye. So these are your eyelids, these are your eyelashes. Sitting up underneath the upper outer corner of your lid is something called the lacrimal gland. And the lacrimal gland creates tears that come across the surface of your eye. And every time you blink, your eyelids work like a windshield wiper, spread the tears around, and what's left drain into the back of the nose. First, these are called the puncta, and then this is called the lacrimal system. This is where most dry eye problems occur. So the things that occur in a dry eye situation is a reduction in the formation of tears, which is not uncommon in menopausal and perimenopausal women. In addition, there's something called an evaporative dry eye, where the oil glands that sit directly behind the eyelashes, called the meibomian glands, get clogged, and the oil doesn't get out onto the surface of the eye. So for instance, in that scenario, if this is a normal, healthy eye, this is the eyelid, this is the muscle that closes the lid, and sitting directly behind it is what we call the meibomian gland. The meibomian gland gets squeezed every time you blink, and a little bit of oil coats the tears and prevents them from being evaporated. But in certain cases, the oil glands get clogged. And this happens a lot with a condition called rosacea, or for people who might have rheumatic issues. And in that case, the oil doesn't get out onto the surface, and the tears evaporate very quickly. So if you're walking on a windy day, or you're in your car or on an airplane, the eyes feel gritty and dry. Sometimes when this occurs, it will actually cause a blockage of the gland, and that will cause a stye or a chalazion. And those are situations where the gland becomes infected because of it being blocked. So in the treatment of dry eye disease, we first have to determine what is the cause, and then secondarily we talk about what the treatments are. In situations where we don't have enough tear production, we might use one of the tear stimulants, and there are a variety of medications, and many of them have been advertised on television. In evaporative dry eye, we might use something that has recently been released onto the market called Mibo, or we might also just treat the oil glands with an antibiotic pill and maybe some eye drops to assist in clearing the gland structure. In any event, we have a lot of tools in our arsenal, and if you watch television these days, almost every commercial about your eyes has to deal with dry eyes. So it's obviously a very big problem, and something that the pharmaceutical companies have adopted as a tremendous part of their obligation to provide relief for our patients.